you recognize and manage shortness of breath in patients with lung cancer receiving immune checkpoint inhibitors? And what should patients be on the lookout for? Shortness of breath is a symptom that many patients, such as yourself, with cancer may experience. In some cases, this may be a symptom that even initially leads you to seek medical attention when you're first diagnosed. You may notice that you're having more difficulty walking. Perhaps you cannot walk as far or climb stairs without taking a break. Perhaps your sleep pattern has changed now, where you now need to sleep on many pillows or with your bed elevated. If you've been on oxygen, you may require additional oxygen supplementation. You may have developed wheezing, coughing, chest heaviness or pressure, in some cases a fever. Some patients might even develop some chest pain, which is quite concerning. If you, as a patient, develop shortness of breath, oftentimes people will be concerned that they're afraid to report that shortness of breath to their healthcare provider for fear that perhaps it might be due to the immunotherapy that they're receiving, and cautious that perhaps we might need to discontinue. However, there are many causes other causes that may lead to shortness of breath in a patient. It may be anemia, so red blood cell count may be low and you may require a transfusion. It may be due to an upper respiratory infection, in which case an antibiotic can easily help manage this. Pneumonia, which again is antibiotic therapy. In some cases, for patients with cancer, may develop some fluid accumulation in the lung, and that is called a pleural effusion. In other cases, a pulmonary embolus may develop, and this is a small blood clot in the lung, which is managed with anticoagulation therapy or a blood thinner. Shortness of breath may be also due to the disease itself. It may be due to complications of underlying pulmonary complications. So if you have COPD or emphysema or a history of bronchitis, you may be having a flare of those other medical conditions. In some cases, shortness of breath may be an indication of some other organ dysfunction, such as some cardiac illness. The most important aspect of management is for you to contact your healthcare provider if you have any change in your level of breathing. So any level of shortness of breath, which is different, give them a call. They can help you walk through and do an assessment to understand what the real cause of that shortness of breath is. And as I stated, in many cases, you can go on to have that adequately managed and continue on with your treatment. I will caution you that if you're having significant shortness of breath and change in your breathing, you need to proceed directly to the emergency room for more urgent care. It's important to carry a wallet card with you that will let other healthcare providers, particularly those at a primary care office or an emergency room, know that you are receiving an immunotherapy, as the evaluation and management of your shortness of breath may be very different and may include several other studies that they need to do.